Okay, so from this DHT, that is dihydrotestosterone, we can continue. This is the active form of testosterone that supports the prostate growth. Okay, so throughout the life, this prostate growth is depends upon this DHT, that is dihydrotestosterone. So the excessive stimulation or the excessive secretion of dihydrotestosterone will be contributing to the development of BPH. Okay, because it's highly sensitive to this androgen production and it will be maintaining the prostate size. So this high sensitivity will be increasing the risk for development of BPH. Now, uh, it is regarding, till now we have discussed regarding the etiology, risk factors of BPH. Okay, now let's move on to the pathophysiology of BPH. Okay. So the pathophysiology is comparatively easier and very easy to understand. Okay. So as like the same other conditions, due to some of the etiological as well as the risk factors. So we have discussed several risk factors for the BPH. Due to that, so among these etiological as well as risk factors, the major causes we are considering is some of the hormonal changes associated with aging process will be happening. Hormonal changes associated with aging process. So what is that? In men, as the age increases, as the age progresses, the active testosterone levels will be coming to low level. It will starts to in a coming to a low level, but at the same time, a small amount of you normally a small amount of estrogen is also is being secreting in every man. So at the when this active testosterone level is getting starts to decrease, the estrogen level will be starts to increase, and this will be increase the activity of DHT, that is dihydrotestosterone. Okay, we have already seen the in the risk factor. So the dihydro testosterone levels will be increasing their activity due to this increased estrogen levels. Then what will happen? We have already studied the DHT, that is dihydrotestosterone, is having the function of promotion of the prostate gland growth. Okay, so due to this stimulation, the increased accumulation of dihydrotestosterone, that is DHT, in the prostate gland will be occurring. Followed by that, it will be stimulate over cell growth in the prostate gland, usually in the inner part of the gland. In the inner part of the prostate gland, this will be increasing the cell growth. Over cell growth will be occurring. Then what will happen? This enlarged prostate, that is the size is being starts to increase. So this enlarged prostate will be starts to compress the urethra gradually. Gradually the urethra will starts to get compressions. So thereby it will be ends up with partial or complete obstruction. Then the patient will be starts to exhibit some of the signs and symptoms, that is difficulty in urinary elimination, and other signs and symptoms will be occur. Okay, so due to etiological as well as the risk factors, hormonal changes associated with aging will be happening. That is, decrease in active testosterone and increase in estrogen level, thus increases the activity of dihydrotestosterone. And this increased accumulation of dihydrotestosterone in the prostate gland will be resulting in over cell growth of the prostate gland, usually in the inner part of the gland. Then the enlarged prostate will be compressing the urethra, and it results in or ends up with partial or complete obstruction, and the patient will be exhibiting several signs and symptoms including difficulty in urinary elimination. So let's see what are the basic clinical manifestation. So the common symptoms is as follows: decrease in the urinary stream, dribbling or leaking after urination, intermittency, hesitancy, pain or burning during urination, feeling that the bladder never completely empties. So these are the things that should be coming into your mind at first whenever you hear the clinical manifestations of BPH, that is benign prostatic hyperplasia. So decrease in the urinary stream, dribbling or leaking, intermittency, hesitancy. Hesitancy means nothing but it is difficulty in initiating the urination. Pain or burning during urination, feeling that the bladder never completely empties. So this is a very cartoonic representation so that you can understand and by heart easily. Frequent urination, urination at night, urgency, difficulty in starting urination. That the word we will be call it as hesitancy. Then weak urinary stream, dribbling at the end, inability to complete the completely empty the bladder, then urinary tract infection. Eventually, it will be developed with urinary tract infection. Then again, the signs and symptoms of BPH can be divided into two major categories, that is obstructive symptoms and irritative symptoms. Obstructive as well as irritative. So in case of obstructive, from the word itself, it is something related to any obstruction to the flow of urine. So the obstructive symptoms include reduced force of urinary stream, difficulty in initiating voiding, that is known as hesitancy, then intermittency, dribbling at the end of urination. Irritative include frequency, urgency, dysuria, that is difficulty in urination, bladder pain, nocturia, that is urination during nighttime, then incontinence. Okay, so these all are the obstructive as well as the irritative clinical features, symptoms of BPH. Along with this, eventually the patient may develop with inflammation and infection, decreased volume and force of the urinary stream, sensation in the bladder has not been completely emptied. We have already discussed the last 2 points. So basically, patient will be ends up with inflammation and infection. That is urinary tract infection basically. Okay, so herewith we have completed the clinical features of BPH. The common clinical features that we have to keeping in mind, the irritative as well as obstructive features and some of the further points. So now let's move on to the diagnostic evaluation. Regarding the diagnostic evaluation, first of all, history collection as well as a physical examination. And followed by this, for the proper understanding or the confirmation of BPH, the physician will be doing rectal examination, or we can call it as digital rectal examination. Basically, what is happening here? It will be showing the smooth, firm, symmetric enlargement of prostate. While palpating, the fingers can feel a smooth, firm, symmetric enlargement of the prostate. Okay. Then followed by this, we can do urine analysis, serum creatinine, blood urea nitrogen levels. That is to understand the just to understand the kidney function levels. Okay. Serum prostate and specific antigen. Then urodynamic flow studies, that is cystourethropy. Here, nothing but this is to measure the peak urine flow rate. Peak urine flow rate. That is to understand the urine stream and its characteristics. And voiding time and volume, status of the bladder's ability to effectively contract. This urodynamic studies will be done, and that is known as cystourethropy. Then followed by this, some higher levels of diagnostic measures are also there. Transrectal ultrasound catheterization. Here we will be measuring the post-void residual time. Okay. Then cystourethropy. This is to determine the urethra bladder and evaluate the prostate size. This is a kind of diagnostic measure, that is visualization, direct visualization of the structures. Okay. Then cystoscopy. It is also to know the size and force of urinary stream. Okay. Then electromyography, EMG. This is to detect any defects in the sphincter muscle. If the muscle functions is not properly, that in order to identify that thing, we have to do electromyography. Then prostatic fluid examination. Here it is to just to understand and determine the presence of infection in the patient. Then CBC, that is complete blood count. So these are the thing that we can recollect. That is history collection, physical examination, digital rectal examination, urine analysis, serum creatinine and blood urea nitrogen, serum prostate and specific antigen, urodynamic flow studies, transrectal ultrasound or catheterization, cystourethropy, cystoscopy, electromyography, prostatic fluid examination, and CBC, complete blood count. So this is the picture showing digital rectal examination. Here, the physician will be, uh, okay.